Hello, this is Test Talk with Temitope. Today, I'll be sharing with you the significance of MP, malaria parasite. Yes, how to get prepared, when to do the test, what to do when you're going to do the test, and what the results should look like when you get the results. Alright, hit that subscribe button if you're new on my channel, and hit the notification bell so that whenever I post, you get the notification. Alright, let's dive right into it. Also, if you have any tests you want us to talk about, you want us to decode, please drop it at the comment section and we will do justice to it. Alright, do you know that malaria parasite isn't just a fever check test? And it is not just a yes or a no test for fever. It is a detective story in a drop of blood. Yes, malaria parasite is advisable to order for that when you feel feverish, when you feel body aches and you feel tired. At that time, the parasites are most active, okay, and visible in the bloodstream. And at that point, when a little quantity of your blood is drawn with either a 2 ml needle, a 2 ml syringe, which is less painful, okay? So I'm telling you the tip now, it's less painful with 2 ml syringe. And then at that point, it is easier and visible to get a substantial amount of the parasite, which will help get an accurate result. Okay, so don't self-medicate. That's one of the mistakes that a lot of people do. Okay, a lot of people make that mistake when they feel that feverish thing and then they are not feeling well. They just run to the chemist around the corner and just get one malaria drugs. No, don't do that. At that point, first of all, it's the lab. Get into the lab and order a malaria parasite test. This point, because a dose can reduce the number of parasites dramatically, which can force or alter the result. And note, treating the fever is not the same as treating the fever and not the cause. Can only hide the culprits. It will only hide the culprits. If you don't treat the malaria, if you don't treat what is causing it, you're only hiding the culprits. So note that you need to hit the lab immediately you start feeling that way. And also, a lot of people ask this question: do I need to drink water? Do I need to fast? No, you do not need to fast for malaria parasite test. And also, you can drink water, okay? Drinking water is okay, and it's hydrating yourself is very perfect and is okay. This will help the free flow of bloodstream, and then easy for us to get the blood in your system. All right, now talking about the results to expect, I want you to note that this test is a microscopic test, and the result is meant to be out depending on the lab that you went to. The test is about 30 minutes or max 45 minutes. But then you shouldn't hasten the lab technicians. Let them do their job. This test is a microscopic test. It is not a rapid test. There's this test they call the rapid test. The rapid test, the RDT, it might be faster and better because it's just a prick, probably on your hand, on your palm, anywhere in your finger, and then it's a kit. It's faster, fine. But as faster as it is, it won't get the actual and accurate count of the parasite, because out of 1 million cells, you're counting something from the red blood cell. It's a lot, and it has to be. It's a microscopic test. Just note that. So don't hasten them. It is okay, and the golden standard way to get the this test done is to hit the lab. Okay, hit the lab for that test. And what to expect because of the count. So when they give you a test, they will write SIN, P falciparum. The P there is plasmodium. So when they say P falciparum, this is Plasmodium falciparum. If it's a SIN, if you see a 1+, it means there is a parasite. A parasite is seen. Probably, for example, let's take out of a 500, and you see probably just 1 or 2. It should be classified as 1+. And now if you now see like maybe 5, 10, that's eating like, when you're counting something from there's a range, a percentage in which it is used in counting it. So there's a 2+ and there's a 3+. And know that if it's a 2+, you need to get the result to the pharmacy, not to the chemist. Not to the chemist, or to your doctor that has advised you to take the test. Okay, so it is advisable that when you get tested, you have known what you have, you have known what is in your system, how crucial it is or how less crucial it is. So the next thing you do is get the result to your doctor or to the pharmacy. They will know the appropriate pill to give to you. Because if it's +1, if it's just 1+, if it's just 1+, they know the one that kills the 1+. If it's 2+, they know the one that is capable of killing the 2+. And if it's 3+, they know exactly the one that takes away the 3+. Alright? So please don't make that mistake. When you get your results, either the pharmacy or to your medical provider. Alright? So that's a wrap for today on your test talk. And remember, if you have any test you want to talk about, please hit the button and come to the comment section where you drop it and let's discuss it. Let's decode it, guys. Thank you so much for listening. Thank you for coming to my channel, and thank you for hitting that subscribe button if you have not hit the subscribe button. And don't forget to hit the notification bell so that whenever I drop something, you would see it. It's an update. Thank you so much. Watch out for the next test. You never can tell. You might be watching it.